Okay, hello everyone, and welcome to part two of How to Ace the UCAT. So last week we went through part one, and in part one we went through abstract reasoning, quantitative reasoning, and verbal reasoning. Today we're going to look at decision making and situational judgment, and then towards the end we're going to talk a bit more about Med2B's course and how you can maybe apply to be on one of our courses, take up and purchase one of our courses. So starting with what is in the UCAT exam. So there's 5 sections: verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment. As you may or may not already know, it's a 2-hour exam for medicine and dentistry applicants. Your score is valid for a single year, and then if you're reapplying, if you take a gap year or something, or you're not successful with your first application, then you have to retake the exam. You need to be sure whether you're taking, whether for your university, you should be taking a UCAT or a BMAT exam. So some universities, they only accept BMAT, some universities only accept UCAT, and you should just check on the university's websites which you're applying to, which ones they accept. And if you are doing only UCAT universities, and there's no real need to do the BMAT. So what is decision making? So decision making assesses 3 areas of logical reasoning, evaluating arguments, deductive reasoning, and statistical and figural reasoning. For me, this was the most easiest section of the UCAT exam because it gave me an opportunity to just work my mind. A lot of the information that's involved can be written out quite complex, but when you break it down and put it into diagrams and simpler, easier terms to understand, the questions aren't actually that difficult. Sometimes you're given the opportunity to identify assumptions, work with Venn diagrams, tables, and there's lots of different question types for decision making, which we'll look a bit more at later. There's 29 questions, 5 correct, 2 markers, 4 correct, you get 1 mark, and 3 or less, you get 0 marks. So that refers to the questions where you're given a piece of text at the start, and then you're given 5 different statements, and you have to decide whether they are correct or not correct. And out of those 5, you can get 2 marks, 1 mark, or 0 marks. So this is one of the type of questions in your UCAT which is worth more than 1 mark, and it's marked differently to the other sections in the other questions. So remember there that if you get 4 of the answers correct, you get 1 mark instead of the 2. It's 31 minutes and you're scored 300 to 900, just like all the other sections. So the key ideas for decision making. So we need to be able to identify quantifiers. So numbers such as sum, which means any number greater than 0, but not 0. Majority means you have greater than 50%. Minority means you have less than 50%. Venn diagrams, a lot of them do come up within decision making. Often you're given the opportunity to either fill in a Venn diagram or deduce information from a Venn diagram. So if you see the word or within a Venn diagram context, it means addition. If you see the word and in a Venn diagram context, it means intersection or multiplication. You need to get used to on-screen calculators. So you can do that through Medify, practicing with your mocks. And the calculator interface on Medify is very similar to the calculator interface on the actual UCAT exam. Don't make any assumptions and don't use outside knowledge. So as I mentioned before, you're often given questions with text at the start, and you should only answer the questions based on what information you are given and not any prior knowledge you have. This is similar for the verbal reasoning section where you're given text and you have to answer comprehension questions. You can't bring any outside knowledge. Get comfortable with probability. So make sure you have your head around things like chance and 50%, 25%, how they are written as probabilities. If you are unsure, flag and skip your questions. That goes for every section. When you're spending too much time on a particular question, make sure you flag it and come back to it, because there may be a question which you won't have time for later, which you could have got, and you could have maximized your marks by skipping the harder questions. So what are the different question types in decision making? So there's logical puzzles, there's syllogisms, there's interpreting information, there's Venn diagrams, there's probabilistic reasoning, and recognizing assumptions. Starting with logical puzzles, so you're given some information will be given, and you must piece them together so no contradiction occurs. Syllogisms, some statements will be given and you must use deductive reasoning to choose what statements follow for them. Interpreting the information questions, you'll be given data, just like in quantitative reasoning where you're given tables or graphs, and the questions will then expect you to retrieve information from it and use it to answer. Venn diagrams, you'll be given a Venn diagram. Using this, you must answer the question. Probabilistic reasoning, you'll be given a scenario, for example, rolling a dice, and you must calculate the probability of certain events occurring. Recognizing assumptions, you'll be given an argument for a particular topic. You must identify the assumptions made in the argument, which renders it as flawed. So recognizing those assumptions are the questions which can be marked 2 marks, 1 marks, or 0 marks. And you'll see a lot of those questions, often the most difficult question in decision making, but as long as you're breaking down each piece of information and breaking down each piece of the text and understanding each piece of the text slowly, you'll be able to answer the assumptions. Moving on. So answering decision-making questions, there's kind of like a step-by-step process. So you want to start off by having the intention of following a logical trail of thought. So you should look at the information given to you, then read the question, then break down the information that's given to you, and work slowly bit by bit so you have an understanding of the question rather than just trying to answer the question based on the text or what you're given, the information that you're given. You should look for keywords that are found in both the text, but found in both the data and the question, so you can make links there. You should use logical thought diagrams, which you can write on your whiteboard, write on a scrap piece of paper if you're given one. And with that, you can then have the information or the data written down in a way that you interpret better. So for me, whenever I had a question, for example, when there's a race and people are at different stages, I then put the words in a diagram which I could easily understand, and then I'd be able to answer the questions better. Always pick answers which are factual / logical, directly answers the questions, and never go for opinions. So that final point of never going for opinions. So don't let your outside thoughts, your outside beliefs, don't let them influence your questions. So a lot of the questions, they are opinion based. For example, it will tell you about a group of friends' pizza toppings, their favorite pizza toppings, and it'll say in the statement, based on everyone's opinions, pepperoni is the best pizza topping. It's important for you not to then bring in your point of view, saying that it's important for you then to not bring in your own point of view to say that pepperoni is actually not the best pizza topping. You should only use what is given to you in the text. Moving further, we're going to look at an example of a decision-making question. So this one, there are 27 people in a club, and club are either adults or children. There are 3 more males than females. 12 of the 16 adults are male. How many male children are in the club? So now if you want to pause the recording and have a go at doing this question, and then we'll just go for the answer in a minute. Okay, so hopefully you've had a go at doing that question. This is the answer here. So the answer for this question, so the first thing that you want to do is make a distinguishment between the number of adults and the number of children. So there are 12 of the 16 adults are males. So there you find out that there are 16 adults, which leaves 11 children. If 12 of the 16 adults are male, you can then put down on your whiteboard that 12 adults are male. There are 3 more males than females. So if you work out how many adults are female, you'll find that there's 4. And if there are 11 children remaining and there are 3 more males than females, you need to take away 12 from, you need to take away 16 adults are male, 11 males and females. Surely I think there might be a mistake with this question, because it clearly says there that 12 of the 16 adults are male. And if there are 16 adults, then there must be 11 children. Okay, let's just skip this question because I think there's a mistake in it. Yeah, moving on. So what is situational judgment? So situational judgment measures your capacity to understand real world situations and identify critical factors and appropriateness between behavior and dealing with them. So questions do not require medical or procedural knowledge. Non-medical scenarios may come up. So it can just be real world scenarios, and you're supposed to just use your professional judgment and your own personal soft skills to come to a suitable conclusion. It's the final section of the UCAT examination, 69 questions, and there are half marks involved depending on how close you are to the actual answer. You're given 26 minutes to answer this question, and you're scored in bands 1 to 4. You're going to try and be aiming for bands 1 and 2 in this section, because that will help you do well in your university applications. So some key ideas, just a few medical points to remember. Definitions for autonomy, beneficence, non-maleficence, and justice. So autonomy is the patient's right to make their own decisions / wishes. And these are the 4 ethical principles of medicine. And you'll find that a lot of the questions are related to these 4 keywords. So beneficence is acting in the best interest of the patient and doing good. Non-maleficence is avoiding causing the patient harm. Justice is treating the patients fairly. And then from that, you're supposed to use those 4 ethical principles and always consider them when you're judging and answering the questions. Confidentiality is not withdrawing patient information to members of the public, family members, without their own consent, and that includes other healthcare professionals. Communication is important with things like the healthcare teams within different levels of the healthcare profession. And do not answer based on how you would react, but how you should react. What is most professional? So a lot of people might have different responses to a particular scenario, but you should consider what the best particular doctor would do within that situation. And that is what you should do. And that is how you should put your answer down to react. So don't do your own opinion, but do what the right thing is to do. Treat each response independently. So that basically means just because you did something good last time doesn't mean you can do something bad the next time. So you should answer each question as its own individual question, and don't let the other questions sway your answers, basically. So there's 2 types of question types in situational judgment. One of them is appropriateness, and the second one is importance. So for appropriateness, you usually have 4 different answer options. You have very appropriate, you have appropriate, you have inappropriate but not awful, and very inappropriate. So very appropriate is the optimal approach, and that is the so you're given a statement, and then if you think it's very appropriate, you think that is the best thing to do. That is definitely what you should do. Appropriate is useful but not the best. Inappropriate but not awful is not a good approach. So there's a few negatives. So there's some advantages and some negatives, but more negatives than advantages to doing that particular thing. And then very inappropriate is going to make the situation worse and have no positives towards the situation. Very important, essential to consider. Important is important, but not absolutely essential. Minor significance is mildly relevant / no harm to consider. and not important is completely irrelevant. So those would be the 4 different answer options if you had a question to do with importance. So how to approach a question based on appropriateness. So identify who the main player is in the question. So you'll be given a text and you need to identify whose point of view we are taking and whose role you are taking. And from there, you can then judge how you should act based on that point of view. So for example, if you were a consultant compared to if you were a Foundation 1 doctor, you would act differently in certain situations. So then you should identify the main problem, identify what the dilemma is and what you are being told to act on. You should read the statement carefully and get out all the key points. Decide which end of the spectrum you should be answering. So based on the statement you have, you should decide whether you think this is more inappropriate or more appropriate, and then you can hone it down into the 2 different answer options for those particular sections. Is there any exaggeration / escalation involved? And inappropriate but have justified elements. So then you should distinguish based on how advantageous it is or how disadvantageous it is, and then you should fit that into the last answer options. So similarly, to answer a question based on importance, you should once again identify who the main player is in the question. You should identify the main problem. You should read the statement carefully. How important is this factor in deciding whether I should do the right thing? And finally, you should evaluate different factors in deciding how to address the problem. So this is just a link I have, which is useful for doing your situational judgment and revision particularly. So it's separate to the GMC's being good medical practice document. It's just broken down a little simpler and often just has the key points. So here you can see on the left, it says tomorrow's doctors, the duties of doctors registered with the General Medical Council. And some examples of things is make the care of your patient your first concern, respect patients' dignity and privacy, be honest and trustworthy, work with colleagues in ways that best serve patients' interests. So having a read through this document will be useful in looking at the principles and the foundations that a good doctor has. And with that, you'll be able to answer your situational judgment questions better, in my opinion. So here's the contents page of this document. So there's things that look at the curricular outcomes, assessing student performance and competence. It goes on to talk about the general principles of a doctor, the UK law regarding medicine, the situation with the medical schools, and just having a read through this document, I think will be useful, and taking any notes from it of stuff which you didn't already know will help you in answering your questions better, I think. So let's just pick a random one. So teaching and learning. No, let's find one, student support. Let's find one. So general principles. So this is just a point on confidentiality. It is important that medical students who have problems with physical and mental health or drug or alcohol misuse are encouraged to get appropriate help so they might receive informed advice and support, including adapted training. Medical students who are ill have the same right to confidentiality as other patients. So the way that this could relate to your situational judgment exam is if you see a question where you have a friend who is clearly misusing drugs or alcohol, then by reading this point, one of the statement options which you could pick is they should be referred to appropriate mental health support, or they should be their information should be kept confidential. And then you'd know by reading this document that that is an important thing to do and a very appropriate thing to do. So definitely have a read through this document. I'll give you a chance to take a picture of it. So it's Tomorrow's Doctors by General Medical Council, and here is the link for the document, and have a read through that before you do your situational judgment exam. So carrying on, here is a question which you can do for situational judgment. I'll read through the text at the top, and then we'll go through the question. So Sam is a third-year medical student on a hospital placement. He has arrived at the hospital at 8 AM for the ward round. His friend Alex, another medical student, joins him. A senior consultant begins to explain that on the ward round, he will be introducing Sam and Alex to a patient who has a condition that they have recently learnt about. The senior consultant says that it would be good for them to find out more about the condition from the patient. After the senior consultant finishes speaking, Alex whispers to Sam that he had been out drinking in a nightclub and the night before and returned home at 4 a.m. this morning. He says that he woke up late, so is wearing the same shirt from the night out. You can smell alcohol from his breath and clothes, but he does not appear to be inebriated. How appropriate are each of the following responses by Sam, the medical student, in this situation? So if you go back to our step-by-step process of answering the question on importance, the first thing we want to do is look who is the main player in this question. So you are Sam, you are taking up the role of Sam. Then the next thing to do is to look at the main problem, the main dilemma in the question, which is Sam's friend, Alex, Alex, who has been out drinking and he can smell alcohol on him. That is the main problem in the situation. And you start to have alarm bells ringing, things about patient safety. Is Alex ready to actually be within a medical environment? And what actions could Sam have? Then you should look at the statement. So before speaking to Alex or the patient, Sam should tell the senior consultant that he feels worried because he smells alcohol on Alex's breath. So your next job is to decide whether this is either answer options 1 or 2, or either answer options 3 or 4. So is this more appropriate or is this more inappropriate? So I'll give you time to have a think about that. So you can start the recording and try and answer this question, and then we'll go through the answer. Okay, so let's have a look at the answer to this question. So before speaking to Alex or the patient, Sam should tell the senior consultant that he feels worried because he smells alcohol on Alex. So there's 4 different answer options: a very appropriate thing to do, appropriate but not ideal, inappropriate but not awful, and a very inappropriate thing to do. The correct answer here would be B. So it is true that Alex has behaved unprofessionally for a medical student. The senior consultant is superior to Sam's position as a medical student, and telling the consultant would ensure that the correct action is taken. So here there's an example of escalating the situation to someone higher up so that it can be dealt with in the correct manner. It is also necessary that action is done before Alex may come in contact with the patient, as not only may Alex come across as unprofessional, but he could also be putting the patients at risk if still intoxicated. However, this situation is not completely appropriate. It is not answer option A, because despite his concern, Sam is speaking to a consultant without Alex's knowledge. Ideally, Sam should voice a concern to Alex first. So the most appropriate thing to do within this situation, and the answer that would, the statement that would give you answer option A would be, Sam should go and speak to Alex first, inform him and have a conversation with him, and then go and escalate it, just so that Alex is aware of what's going to happen. Sam should say to Alex that if he does not go home, he will involve the senior consultant and the medical school, which would be answer option A if that was our question. Moving on, we're going to look at how to sign up to Med2B. So Med2B, we've organized a course. I'm just going to bring up the website. So we've organized a course which involves different videos of breaking down each particular section. So for abstract reasoning, we'll have a part on what is abstract reasoning, the different types of abstract reasoning questions, particular tips and advice on how to answer abstract reasoning questions. We're going to give you some example and abstract reasoning questions, and that's all going to be done in easy to understand videos and easy to access videos, and that is done for each section. And basically, me and Ismail, who've made these videos, we scored above 730 in our UCAT exam, and we've given you as many tips as we have to help you obtain such a score. So for medical students, people applying to medicine or dentistry, you can purchase this UCAT course. So it's a self-paced online UCAT teaching. It's taught by medics who scored more than 730 in last year's exam. It's 2 months Medify UCAT subscription included. So you don't actually have to purchase Medify separately when you buy this course from us. So we're working with Medify, and with that, you get your own Medify subscription straight away. And that's starting at £99. And with that, we can track your progress on Medify, and we can tailor help towards helping your weaker sections. So if you are struggling with something like situational judgment, we'll be able to tell. And from that, we can then help you, and we can give you your own one-to-one sessions if needs be. We also offer personal statements help. So when you're going to applying for university properly, we provide you with resources to help you compose an amazing personal statement, one-to-one feedback to perfectly write your piece of writing. And with that, everyone who's helping you has had a successful application into medicine or dentistry. So we know what it takes to actually do well and actually write a good personal statement. And we've had practice, we've helped other students who have been successful. We've actually helped students go through their UCAT, go through their personal statement, go through their interview preparation. And with that, they've been able to get a successful application into medical school. So if you did want to buy the personal statement package, that comes at £75 starting. The interview preparation, once you do get successful, get through to the interview stages of your UCAS application, we help you in answering good UCAT questions. We can run mock interviews. We also help you to perfect your answers and help draft up some answers to some common questions. We give you advice on how we pass our interviews. So for me, for example, I pass interviews for Imperial, Nottingham, Birmingham, and also King's. So so within our larger team, we have people who've applied to lots of different medical universities, lots of different dental universities. So we know what questions to expect for different universities. And with that, we'll have the right people to help you for your interview preparation. So leave no stone unturned by choosing our excellent consultants to prepare you for the medicine interview session, and that starts at £75. So if you do like what you've listened to here, and you do want a bit more, you want a bit more tips and tricks, and you want a bit more help in answering the actual questions, then definitely do look on our Med2Be Consultants website. There's a contact us tab where you can go on to get in touch. You can have a contact form, you can ask any questions. There's even an email there, so med2beconsultants@gmail.com. And with that email, you can send us an email, ask us any questions, and we can set you up that application. We can set you up that package and get you on track for either your interviews, your personal statement, or for your UCAT revision. If anyone just has any questions now, please, you can email us with your questions, or you can put them in the chat now if you have any questions. Hey guys, everyone just coming back to this question on decision making. I think I might have misread it. So if you did get an answer, the answer was actually for male children, it was 3 male children. So the answer was A. So how I broke that down was I separated the adults and the children. So for adults, we had 16 adults, remaining 11 children if there's 27 people in the club. Then I'd break down the table and I'd put males for adults, females, adults, and then I'd do male children, female children, and I'd fill in the boxes. So I know that we have 12 male adults, we have 4 female adults, and we have 11 children altogether. And if we need 3 more males than females, our combination would be 8 female children and 3 male adults, leaving us with a total of 15 total males and 12 total females, meaning that we have 3 more males than we have females. So our answer would be A. So sorry about that. I did misread the question, and I hope that's helped you in understanding it, and hope you have got your answer there. So yeah, as I said, guys, if you do have any further questions, please feel free to email us, get in contact with us, and do remember to look at our website just so you can look at our packages and look a bit more about us. And we are qualified, and we are all medical students, dental students, and we're here to help you and give you guys the tips and the tricks that we learned to help you do well. Thank you.